Alina Naraki here from Dental Arts San Diego. Welcome to our implant series. Bacteria or calculus, as you can see in this picture, it is years of accumulation. And what is tartar? It's a mineralized proteins and salts mixed with bacteria. There is 4 types of the worst bacteria that you can imagine. Aggregatibacter actinomycetum comitans. Number 2 is Campylobacter rectus. Number 3, Porphyromonas gingivalis. Number 4 is Capna cytophaga species, different species of that bacteria. Now, why is that important to know? Many thousands of bacteria, some of them are good, some of them are moderately not good, some of them are really, really bad, and extremely pathogenic. So these 4 that I gave you is extremely pathogenic. Now, they can cause chronic gum disease. It is also a risk factor for the development of certain cancers, including ones involving pancreas, esophagus, colon, lungs, and the head and neck. Additionally, this particular bacteria, 4 of them, can also leak into the blood vessels. And you can see in this picture, after we clean all these deposits of tartar from the patient's mouth, you can see how much naturally bleeding occurring in the gums. It's not us doing a surgery or anything like this. It's what the gum looks right after, immediately after the procedure of a deep cleaning or root cleaning and scaling. These bacteria can leak from the mouth, from the removal of the tartar into the blood vessels in the gums and travel to the heart. And in the blood vessels, there is some levels of cholesterol and other lipids deposits. So once the bacteria reunites with these components, it can incite inflammation in arteries, and if occluded, cause a heart attack. The periodontal bacteria are also a cause of arthritis. It gets potentiated or irritated or ignited the level of pain that people experience in their bodies by the presence of this pathological periodontal bacteria. So recent medical studies point to poor oral health and high levels of the bacteria in our gums, increasing the risk of developing dementias such as Alzheimer. How do we link it together with an implantology? Well, if you can accumulate that much tartar on your natural teeth, of course, you're completely capable of doing the same thing on your implants that have been placed. From the perspective of health, it's extremely important to go for the regular cleanings. Thank you so much. That was Alina Naraki from Dental Arts San Diego. I will see you in the next video.